Assalamu alaikum, everyone. Nice to see you, Dr. Hammami. How are you doing?
Good, Sally. How are you?
I'm good. So I'm Sally Howell. I'm the director of the Center for Arab American Studies at the University of Michigan, Dearborn. And this is our first installation of the second part of the Zoom In on the Halal Metropolis series. We're interested in the ways in which the Muslim community in the Metro Detroit area is participating in the response to COVID and is also being affected by COVID. So I'm very happy to have Dr. Hammami with me. Dr. Mouhannad Hammami is the Chief Health Strategist for Wayne County. And so he's sort of the Anthony Fauci of Wayne County, I guess. And he also is a professor who teaches many of our public health classes at the University of Michigan, Dearborn. So I really thank you for taking the time to talk to me today. So first, can I just ask you how you and your family are doing?
Thank you, Sally. Yes, absolutely. Good to be here, and I'm glad that we have the opportunity to talk. We're doing good. We're doing good. I think we're just like every other family, and especially our community, where we had our ups and downs. We counted on our family unit for support. We counted on what makes us resilient. I always joke about it. We dug into some practices that we never practiced before. And some of you might know, I grew up, I was raised in England, so I dug into my early childhood and we established tea time. So during especially the lockdown, I have two teenage boys and of course my wife and I, and we decided, okay, we are going to have tea time at a certain time where we sit, we have tea, eat biscuits and share our thoughts and communicate with each other. And it truly is a blessing. We still continue to do it now, even though there is no quarantine, although not at the strict intervals. But just the fact that you can sit, share your burden and bond and talk about anything, whether it makes you happy or worries you, I think that was a very good healing process.
That's very nice. Well, it's good that you've got, two children at home. My husband and I are here by ourselves at this point, and it gets kind of lonely. Well, so how are things going in Wayne County?
Things are going as good as they can be. Of course, we are just like every other county and the state at large and even the country. We are seeing now a rise in the cases. We are looking at numbers that we haven't seen even during the beginning of the pandemic. But we are now more or less in a system where we know what to expect and we are addressing those. So we boosted our capacity, for example, for testing. We boosted our capacity for case investigation and contact tracing, as these are the three major things. You need to test so you can detect early, and then you need to make sure that you're following up on the positive cases. We have put a lot of investment in resources, both financially and in human resources, to expand our testing capacity, specifically in communities where we believe they need more testing, but also communities that have barriers. We partnered with several community organizations. One specifically that the community might relate to is Hype Athletics. And we currently have a 6-day-a-week testing site at the Dearborn Heights as well as at the Wayne location. Another thing that we wanted to make sure that we're addressing is the social needs. We know that this pandemic has exposed a lot of the vulnerabilities that some of our community members might be facing. And this is why that partnership with HYPE was very essential, because we do social screening. They have a 24-hour hotline. We are partnering with organizations such as Forgotten Harvest and Gleaners and homeless shelters and all that. So we try to approach it from a wraparound approach that would certainly address not only the health part, but also the social part, and also as well as the mental and psychological safety of our community members.
That is so important, because we know that this is affecting every single possible aspect of life. So I'm glad to hear that. Yeah, so I mean, I remember that in the first stage of the pandemic back in the winter, the city of Detroit seemed to be it was obviously the major hotspot here in Michigan, and we lost a huge number of people from the city of Detroit But now I'm seeing that Detroit is doing better relative to the rest of the county and really doing better relative to the rest of the state. So can you tell me a little bit about what you guys did to bring about that change?
I wish I can take the credit for that, because Detroit has their own health department, but we certainly work with them closely. You're absolutely right. I think initially when this pandemic caught us off guard, unfortunately, it has affected mostly those that are essential workers, the minorities, the people that are living in crowded housing and all that. And I think we saw that wave go away after the mitigation process. The city of Detroit has put some very strict measures in place, including the face covering, the screening, and all that. And also, I believe some of the services that they provided for their residents have eventually paid off and contributed to how we're seeing the lower incident. There is a slightly bump now in the numbers, just like everybody else. But again, you're absolutely right. It is not as hard or as bad as it used to be.
Well, I noticed from um, Facebook in particular, but just because of my networks in the community, just in the last few weeks, I've heard of so many Arab Americans getting sick. And it's affecting like every part of the Arab community. It's not in any one place or another, but I mean, it's distressing me. Do you have any words of wisdom for the Arab community? Any I mean, what do people need to know? I mean, I think we all know what we should be doing, but how can we help the Arab community be a little bit more responsive here?
And I hate to say that because we're being accused of signaling or singling one community versus another. Unfortunately, the numbers do show that we have the highest in Wayne County are the communities where the majority of our Arab and Muslim members live in, i.e. Dearborn Heights. We're seeing a little bit more in Hamtramck as well. Um, and I think part of it is the culture of where we come from. We have multi-generations that interact with each other or live in the same household. We also have many of us that are essential workers that cannot be quarantined or cannot not go to work or cannot work in places where they can maintain that distance. So I think the advice is similar to what we give to anybody else. Be responsible and make sure that you are adhering to whatever makes sense. So let's not do these big gatherings, for example. This occasion, as much as it's dear to everybody, it can probably wait, or we can limit it. We can. It's very disappointing. I'll be honest when you have a wedding that you don't want to include everybody in. But maybe this is not the right time to do that, and maybe we can celebrate it later and once it makes sense. We're seeing some of the I wouldn't call it risky. Risky is a strong word, but it certainly puts people at risk, no matter how careful you are. If you have a gathering of 50 or 100 people, as much as you are going to adhere to putting your mask on and maintaining 6 feet, it's not going to work. It is
It's
risky.
really hard to not hug someone you haven't seen in 4 months,
Right. So these are some of the things that us as a community and culturally we are guilty of, because as you said, our first instinct is to hug and kiss and shake hands and all that. And now all of a sudden it feels strange. It is not part of the DNA. And this is what we are doing. We have actually at the county, we're doing a public campaign that is targeting our youth as well as our middle-aged population, so 19 to 25 and 45 to 65. And it's going to be trilingual, in fact. It's going to be in Arabic, it's going to be in English, and it's going to be in Bengali. And the key is focusing on our youth that might think that they are young and invincible, which they certainly are, but they might not know that when they're going back to grandma and hugging grandma, they might be putting grandma at risk and even threatening her life.
Almost everyone I know who has a college age kid has had someone in their household who's been sick. And it is really hard to live in a household with a sick person. And,
Oh, absolutely.
you know, it's been so frustrating for everybody. This is just a challenging time for families. And I know that the Arab community has all these big extended families. So, so I have a question. I want to know if you could tell me if you can think of anyone who is a specific hero to you in this COVID moment. Does a medical person, someone who is doing the contact tracing, do you have someone who stands out in your mind as a hero?
Not specifically, but I know a lot of heroes are those that are on the front line day in, day out. Not only those that are taking care of the sick patients, and not those that are making sure that we have food. The grocery workers, the food preparers, the cleaners, the public servants, health professionals. All those are heroes. The law enforcement personnel, as you know, Wayne County has the 3 jails and the juvenile detention facility, and our deputies, our staff, and everybody there are heroes for going in every day and maintaining what they are supposed to do. These are my heroes, and everybody else that is in that category.
All right. Well, so believe it or not, we're already out of time. But I want to thank you for coming and talking to us. And I want to encourage the audience to tune in. We're going to start posting these once a day now. So if you have a story that you want to share related to COVID and how it's affecting your family or your place of employment or the community at large, please get in touch with us. And is there a number of people can reach out to the county so that if they need assistance or need to know where to go for help? Is there a number, or do you just...
Absolutely. Well, if you go to our website, waynecounty.com, there is a slew of information where the testing sites are, how you can get help, a lot of public information on prevention and what you should do and what you shouldn't do. We update that regularly, especially that we are getting into the holiday season, how to celebrate the holidays in a safe way. And also, the last thing that I wanted to mention, we are currently distributing close to 3 million masks. So everyone in Wayne County, literally, because we're a county of 1.2 million, 3 million masks. Every resident in Wayne County would have at least 2 masks. We're doing that through the schools, at our testing sites, and through our communities.
Great, thank you. Well, thank you so much for joining us, Dr. Hammami.
My pleasure, Sue.
Good luck in all that you do. It's so important. Thank you.
Thank you. Appreciate it.
Bye-bye, everybody.